Welcome to Introductory Anatomy and Physiology. I am Samuel Kisi. Today we would consider anatomical terminologies in relation to anatomical positions and anatomical directional terms. Scientists and health care professionals like nurses use a common language of special terms when referring to body function and body structure. The language of anatomy has precisely defined words with meanings that all health professionals are able to communicate in clearly and then unambiguously. Now, we want to first consider anatomical positions. Well, when we see anatomical positions, we see in the picture there standing erect, palms and feet all facing forward. Now, this is a standard reference point in which all positions, movements, and planes are described. When we see a body in anatomical position, we imagine a midline that divides the body into equal left and equal right. Now, two terms that we would want to start with is superior and inferior. We often describe these directional terms in relation with other body structures. Now, when we are describing structures in anatomy, these are the terms that we use. The first one we would want to consider is superior. Superior refers to structures that are closer to the head or higher than another structure in the body. So we can give an example that the heart is superior to the liver. We can also say that the eyes are superior to the nose. In the same way, the nose is superior to the mouth. And I know you can give other examples. Now, inferior, it refers to structures that are closer to the feet or lower than another structure in the body. So an example would be the stomach is inferior to the lungs. Can you think of any other examples? Now, anterior and posterior. Anterior refers to structures that are more to the front than another structure in the body. So we can give an example, structures that are nearer to the front. The sternum, that is the breastbone, is anterior to the heart. Can you think of other examples, structures that are closer to the front than other structures? We could consider the nose and the occiput. The nose is more toward the front than the occiput. So we can say that the nose is anterior to the occiput. And the opposite applies to posterior, structures that are more to the back than another structure. So an example would be the occiput is then posterior to the nose. Now, if you remember, we said we have an imaginary line that divides our body into right and left. So keeping this point in mind, then we come to the next term, medial. Medial refers to structures that are closer to this imaginary midline or the medial plane of the body than another structure. So we can give an example of structures that are closer to this midline in relation to other structures. So an example would be the mouth is medial to the eye. The mouth is more closer or even closer in the midline than the eye. And then the nose is also medial to the ear. Then the opposite would apply, that structures that are further away from this midline than other structures are said to be lateral. So the ears are lateral to the nose. The ears are lateral to the eyes. Can you also think of other examples? Now I want to consider distal and proximal. Distal and proximal are used to describe structures on the extremities. So we have the upper extremity or the upper limb and then the lower limb. And they have roots of attachment. Structures that are closer to the roots of attachment are said to be proximal. And then structures that are further away from the roots of attachment are said to be distal. So we want to take note of that. Distal, if you want to remember this point, distant. When we say something is distant, then it's further away. So structures that are distal are said to be structures that are further away from the root. So we can give examples as the finger bones are distal to the wrist bones. Proximal is structures that are closer to the roots of attachment. So we can say that the arm bone is proximal to the radius. Superficial and deep. Structures that are closer to the surface are said to be superficial. So we can give an example as the sternum is superficial to the heart, and then the heart is also deep to the sternum. Ventral and dorsal synonymously with anterior and posterior. Ventral is synonymous to anterior, and then dorsal is synonymous to posterior. Note these terms. Prone. The body is said to be in prone position when it lies face down, like we see in the picture, and then the body is said to be supine when it lies on the spine, as it were, face up. Unilateral, anytime you hear unilateral, we are talking about structures pertaining to one side. Bilateral, we are talking about to both sides. Thank you for listening.